there's many of us that will live with cancer and have to coexist with this disease. And the idea that we can give a voice and now faces to the issues behind living with metastatic breast cancer is the goal of advocacy and action. What does the word survivor really mean for a metastatic breast cancer patient?
I think it means different things to different people, and it's a word that I've never been comfortable with even after my primary diagnosis. People would say, I'm a breast cancer survivor of blah, blah, how many years. And I would always say I was diagnosed in 1996. I think the word is a very loaded word. And, you know, we can argue semantics, and we do on, you know, in the metastatic community, there are certain buzzwords that really get people going. And it's probably not worthwhile because I finally learned you have to think of what people intend to say rather than the exact word and how they say it. So I don't really have a problem with other people using the word. It's just something that I don't use. And I think there are a lot of definitions for it. And but to me, it's you have lived through something that's in the past. And I never felt that way even about after my primary diagnosis. And I certainly don't feel that way now because, you know, I don't feel like I'll survive this disease. I know I won't. So that's what, you know, that's my problem, I guess, with the word. But, you know, I understand what people say when they use the word. And there's a lot of people with metastatic disease that do use the word.
I will survive until I take my last breath. And then you can say she no longer survives. She's dead.
Because you're living.
Because I'm living. But I agree and I respect. And I agree totally with Maria. It's not worth really a lot of discussion. So many more important issues to worry about.
What we've heard over and over at Living Beyond Breast Cancer is this word is very charged.
Yeah.
And it is about semantics. And semantics can be important as I think you had previously said. It's not what we say, but how we say it. But we also have to be respectful and open that everybody has different interpretations. So if I interpret it a certain way, that may feel right or it works for me. It doesn't necessarily mean it works for you or the next person. So I think as long as there's that balance of whatever language or word helps us get through the day. As you said, Shirley, you're surviving until the last breath. You're living. That works for you. But we definitely hear over and over different words, whether it's thriver, survivor, or a lot of pushback on the term. I do think it's prevalent, it's out there, and it's part of discussion.
Right.
There's another word that definitely strikes a note with many metastatic patients whom I talk with, and that's the word chronic when it's used to apply to metastatic breast cancer. I think for many people, and in fact there was at this meeting a whole session on metastatic breast cancer as a chronic disease. And I think for the same reason that survivor is difficult. The word chronic is difficult because in most people's minds it implies a long time course and an entirely manageable disease. And for many women, and most women with metastatic breast cancer, that's not really the course of the disease. And I applaud you in this panel today for presenting a variety of faces of breast cancer. Someone who is no evidence of disease and really doing well, and someone who's actively struggling now in the moment, because this really is the face of metastatic disease as we know it today.
I want to thank each of you and hope that we walk away. You can't problem solve in this period of time, but what we can do is create tangible arguments, common language, and get us all focused so when we walk away with this advocacy and action, it's a call to action, whether you're an advocate, whether you're a researcher, whether you come out of industry, or if you're an oncologist that really has to learn how to communicate better with patients facing metastatic disease.